Okay, so our assessment components. First of all, like we would do in most comprehensive reports, review of documented history. I would really strongly encourage psychologists who are involved in this realm to include not only psychodiagnostics with appropriate validity measures, but also cognitive testing. It's just an added dimension or domain that we can then consider, especially the concentration, persistence, and pace variable, data that we actually have ourselves. It's great that we have our OT colleagues, but it's really nice to have some of our own data as well to really get a handle on at least one of these domains, because without that, we're not measuring any of those other domains directly. And it's something that we can readily do, especially if you, somebody like Paul, who's a neuropsychologist as well, who's quite used to cognitive testing, and it also can be very helpful from a diagnostic perspective in terms of identifying and making differential diagnoses, even within the psych realm. Generally speaking, the more severe the major depression, then the more impact it will have on the cognitive testing. That's a rough rule. So somebody with an adjustment disorder with depression, for example, we're not going to be expecting impacts on cognitive functioning with that kind of diagnosis. But as I say, with increasing severities of major depression, we're more likely to see. The in-home ADL assessment. And then ideally, I've got to change the slide now. We used to do multi-day situational work assessments. It used to be 2, sometimes up to 3 days. 3 days especially for brain injury. We do those still as a rebuttal service, but again, because of the way that the IEs have gone and the limitations on funding, typically the situationals have been reduced to a 1-day situational work assessment. Yeah.
Is that in addition to the in-home?
Yes, in addition to the in-home.
We have that, I have OTs in the state of New but a community situational, if they don't have a job, there's still
Right.
things.
Well,
The
the-
insurers don't seem to want to go through.
Right. So the important thing to recognize is that the AMA guides categories include ADL and include adaptation. Adaptation to a work-like environment. So it's confusing because people will equate that, say, to the post-104 disability test, the question of whether the person can work. It's not about working. It's about the impairment, severity, and impact. If the claimant or patient is exposed to a work-like environment, how do they cope with that? Is there an increase in their symptoms, in their pathology? Do they break down in tears? Do they have a panic attack? The next day, are they wiped out in bed for 3 days? Which reminds me, it's important after the situational to do a telephone follow-up to find out how the person's functioning as a response. So it's about the pathology and the acuteness of it under pressure. It's not really about working. So the notion of doing a community assessment as an extension of ADL in lieu of a work situational assessment, that's incorrect. Might be appropriate for the normal life test, but in the context of CAT, that's not what it's all about. It's not about replacing it. It's about putting a person into somewhat of a pressure cooker to see if the symptoms will become exacerbated. Adaptation to a work-like environment. Okay.